You are very welcome to this session. And in this session, I'll consider the topic that is coming from the cardiovascular system, hypertension. The information that will be given in this presentation may be a bit brief, but it is ideal to have the general picture of hypertension. Do not forget to subscribe to this channel, as this will help in making of more videos. It's also important for us to understand the cross structure of the heart. And usually those who are attempting to write qualifying examinations, it's critical that you demonstrate your ability in knowing how to draw the heart. By definition, hypertension is considered to be a condition in which there is consistent elevation of arterial blood pressure, that is historic of 140 and diastolic above 90 millimeters of mercury. Alternatively, it can be defined as a condition in which there is consistent elevation of systolic blood pressure above 140 millimeters of mercury and diastolic blood pressure above 90 millimeters of mercury. It's also important to note that hypertension is classified into two groupings. The first one is known as primary or essential hypertension, and the second one is known as secondary hypertension. It's worth noting that this condition that we are discussing, it has been for a long period of time been known to be a silent killer because it presents at times without any specific signs and symptoms. It's important also to take note that essential or primary hypertension is the most common type of hypertension and accounts for 90 to 95% of all hypertensive conditions. Contributing factors to essential hypertension would include, number one, heredity, meaning someone can inherit this condition, excessive salt intake, altered renin-angiotensin mechanism, extreme levels of stress, which will lead to increased stimulation of the sympathetic nervous system, cigarette smoking, because we understand cigarette smoking facilitates the consumption of nicotine, which is a potent vasoconstrictor. Obesity, which usually is coupled with a lifestyle that lacks exercises, which is sedentary lifestyle, elevated serum lipids, advancing age. And on this one, it becomes a normal phenomenon because as one grows old, usually what would happen is that their system is also degenerating. Race on this one is more common in African race than any other race that can be considered. It's also very important to note that secondary hypertension accounts for the difference from what essential hypertension or primary hypertension was accounting for. And therefore, in percentage form, this is approximately about 5 to 10%. Now, this type of hypertension, which is secondary hypertension, it has a definite cause, okay? Meaning we'll have a condition which is playing a critical role in ensuring that this hypertensive disorder is noticed. But in primary hypertension, the cause is usually idiopathic. The causative factors or contributing conditions to secondary hypertension could include, number one, adrenal gland tumor, anxiety and stress. Apart from this, atherosclerosis, birth control pills, coarctation of the aorta, endocrine disorders such as Cushing syndrome, diabetes mellitus. So to simplify these classifications, it would be very important to note that essential hypertension is caused by unknown factors, and therefore predisposing factors arise and are attached to essential hypertension. Secondary hypertension is being caused by things that we can point to. Let's go through the pathogenesis of hypertension. What is the pathophysiology of hypertension? Now, the renin-angiotensin system will be activated if, for example, there is inadequate supply of blood to the kidneys, and therefore the hormone renin will be released. Its release will lead to the conversion of angiotensinogen to angiotensin 1. Angiotensin 1 will later be converted with the help of angiotensin converting enzyme to angiotensin 2. After we have obtained angiotensin 2, this is a potent vasoconstrictor. And because of this, it will lead to hypertension. Besides this, it's also very important to note that at the same time, there will be the production of aldosterone. Aldosterone is at times known as antidiuretic hormone because it will lead to the retention of sodium, which will be translated into the massive retention of water. And this results in an increase in the circulatory volume. And this leads to hypertension further. And apart from that, it may also lead to edema. This is due to the extravasation of fluids from the intravascular space. It's also worth noting that some of the signs and symptoms that may be noticed include confusion. This is due to damage to the brain. And by the way, confusion may come as a result of cerebral hypoxia, chest pains, palpitation, nosebleed, fatigue, headache, edema are some of the signs and symptoms. On the investigations, it's very important at all times that we need to take note of the history. And this history may just reveal that in that family where such an individual is coming from, they could be suffering from hypertension. Physical examination would be very important. For example, on palpation, on auscultation, all of these will just demonstrate that this individual has hypertension. Blood pressure estimation, renal function test rule out renal disease. Aortography, it's also important. Renal angiography, urinalysis. So these are some of the investigations. On the treatment, it's very important that hypertension is treated with a grouping of drugs. The alpha blockers, angiotensin converting enzyme inhibitors, beta blockers, calcium blockers, diuretics, vasodilators, analgesics, and apart from that, we can also ensure that we implement non-pharmacological interventions, such as ensuring that this patient has enough rest, and also it's critical that we adjust the diet. Now, on the complications, this may result in congestive heart failure, kidney damage. It may also result in stroke, which is CVA, vision loss, and brain damage. This is important to take note. And to sum it up, there is this question that may be of very much importance. In this question, we are told that an individual known as Mrs. Tembo, aged 44 years, married with 6 children and working as a headmistress at a local school, is admitted to a medical ward with a provisional diagnosis of secondary hypertension. Then in this question, we are expected to explain the pathogenesis of hypertension, which is the pathophysiology, stating the 5 signs and symptoms, describing the management of Mrs. Tembo, and of course, using the following headings: medical management, specific nursing management, explaining 4 complications of hypertension. Thank you for listening and hoping that you got 1 or 2 things from this presentation. Please come back, subscribe for more videos.